the 2020 Behavioral Health Symposium. We are happy to host this event as a virtual conference because we care about your health and safety. But we also understand how important it is to provide relevant and robust continuing education to Louisiana healthcare professionals. For quality purposes, all participants will be muted during the presentation. If you would like to submit a question to the speaker, please use the Q&A feature in the virtual platform. This session is accredited for 1.25 hours for the following: social workers, general credit, peer support specialist, nursing contact hours, AMA, PRA, Category 1 credits, and licensed professional counselors. Full participation is required to receive credit and will be monitored throughout the session. You will receive an email from Women's Federal Foundation with detailed instructions on how to claim your credits and access your certificates. Additional information is available in the digital event booklet. Robyn McDermott and Candace Grace have no financial disclosures. None of the members of the symposium's planning committee or any session moderators have any financial disclosures. This session is entitled Telehealth Utilization in Medicaid Behavioral Health. The presenters are Robyn McDermott and Candace Grace. Robyn McDermott serves as the Deputy Assistant Secretary for the Louisiana Department of Health, Office of Behavioral Health, leading the Division of Health Plan Management. In her position, she oversees programs responsible for oversight of the multiple Medicaid managed care entities that administer Medicaid behavioral health services in Louisiana, inclusive of policy development, quality management, provider network development, and business intelligence. Robyn holds a master's degree in clinical psychology and has over 20 years of experience in behavioral health. She previously served as the statewide director for Louisiana's Early Childhood Support and Services program and as a lead over behavioral health provider network management and development, fiscal policy, and accountability for OBH's Division of Administration. Joining her is Candace Grace, who currently serves as the Director of Quality Management for the Louisiana Office of Behavioral Health, where she is responsible for oversight of quality monitoring and assurance activities for Medicaid specialized behavioral health services with the goal of improving member quality of care and outcomes. Candace previously served as the Medicaid Waiver Assistance and Compliance Section Chief, where she oversaw several home and community-based programs under various authorities. Candace holds a bachelor's degree in psychology from Louisiana State University, and a master's degree in school counseling from Southeastern Louisiana University. So now let me welcome Robyn McDermott.
Good morning, everyone. Robyn McDermott. I am going to ask your forgiveness while I take off my glasses. A little funny with age. I'm not able to see far away without the glasses, but without the glasses, with the glasses, I can't see close up. So, although we'll be going through this PowerPoint presentation, please forgive me as I refer to my papers here. So let's just talk a little bit about what our objectives are this morning. Today, what we'd like is for participants to leave here with an understanding of the behavioral health, telehealth flexibilities permitted under Louisiana Medicaid, understand current Medicaid behavioral health, telehealth utilization trends and patterns, and understand some recent survey findings related to behavioral health, telehealth challenges and supports in Louisiana. One quick note, throughout the presentation, we'll use the terms telehealth and telemedicine interchangeably. We realize that generally speaking, telemedicine refers to remote clinical services, while telehealth can refer to remote non-clinical services. But for today's presentation, we're going to use the terms interchangeably. So let's begin our talk this morning with a definition of telehealth in Louisiana. Louisiana statute defines telehealth as a mode of delivering healthcare services that utilizes information and communication technologies to enable the diagnosis, consultation, treatment, education, care management, and self-management of patients at a distance from healthcare providers. The Louisiana revised statute is there on the slide for you if you want to review more information. In addition, telehealth refers to the use of interactive telecommunications equipment that includes, at a minimum, audio and video equipment, permitting two-way, real-time, interactive communication between a provider and their patient. Telehealth allows services to be accessed when providers are in a distant site and patients are in an originating site. Telehealth facilitates patient self-management and caregiver support for patients. Now, these are descriptions of what we mean by telehealth under normal circumstances. In other words, the non-pandemic circumstances. We're going to talk a little bit about what is allowed in Louisiana Medicaid for delivery of behavioral health services via telehealth, normally or pre-COVID, and then we'll focus on what flexibilities are being allowed for behavioral health telehealth during this public health emergency. So let's talk a little bit about who can deliver Medicaid behavioral health telehealth services under normal conditions. So that's that pre-COVID conditions. Keep in mind that these may be different for private payer sources, for grant-funded programs, for private insurers, et cetera. But under Louisiana Medicaid, it's fully licensed mental health professionals providing the service within their telehealth scope of practice as determined by their professional licensing boards. So who are considered licensed mental health professionals in Louisiana Medicaid? These include psychiatrists, medical psychologists, licensed psychologists, licensed clinical social workers, licensed professional counselors, licensed marriage and family therapists, licensed addiction counselors, and advanced practice registered nurses with specialties in treating psychiatric disorders. What are the services allowed via telehealth under normal circumstances? So in other words, at any time pre or post-COVID. Those are individual psychotherapy, family psychotherapy, and medication management services. These three may all be reimbursed when provided via approved telecommunication technology. What do we mean by approved telecommunication technology? That refers to the HIPAA-compliant audio and visual interactive communication platforms we discussed a few minutes ago when we were reviewing the definition of telehealth. Now let's talk about the additional services LMHPs can deliver right now during the COVID pandemic. Again, I want to caution that these are allowed under Louisiana Medicaid, and licensed mental health professionals should check with their respective licensing boards if there's any question. In March of this year, the Louisiana Department of Health issued approval for LMHPs to conduct assessments, evaluations, and testing via telehealth for dates of service beginning on or after March 21st, 2020. In addition, telehealth may be utilized for outpatient group psychotherapy. So folks can find more information about this on the Medicaid website. Medicaid houses informational bulletins on their website for providers that give different guidances, different outlines for delivering both behavioral health services and non-behavioral health services. These are established in the form of what they call informational bulletins. You might also hear them referred to as IBs. For LMHPs, you'll find information about the telehealth flexibilities under Informational Bulletin 20-6. And we've also put together a handout with additional resources, which we'll make available after the conference. That document will include a link to that informational bulletin. The Louisiana Department of Health has also established certain allowances during the public health emergency for outpatient substance use providers. In particular, effective March 21st, 2020, LDH issued approval for the delivery of outpatient substance use disorder services. So on the slide, that OP-SUD refers to outpatient substance use disorder services. This also includes intensive outpatient SUD services, otherwise commonly referred to as IOP. Outpatient substance use disorder providers may utilize telehealth for conducting substance use disorder screenings and assessments as well. And lastly, telehealth may be utilized for outpatient SUD treatment groups if this service is related to the recipient's goals, objectives, and interventions in the treatment plan. Again, keep in mind, this is under Louisiana Medicaid. So providers treating patients with private insurance or other payer sources should consult those organizations to determine what may be allowed and reimbursed. Folks can find information about outpatient substance use disorder telehealth on the Medicaid website under Informational Bulletin 20-7. Again, this link will be on our handout for resources. I'm going to do a quick stop because I'm not sure if the slides are progressing. Okay. Pardon me, everyone. I have not been doing my job of progressing the slides for you. Okay, I think we're on track. Another set of services granted telehealth flexibilities under this public health emergency are our mental health rehabilitation services, commonly known as our MHR services. LDH approved certain telehealth allowances for MHR services beginning March 20th of this year. To reiterate, these services are not normally able to be provided via remote or virtual delivery and generally require that the services are in person or face-to-face. However, as we realize the importance of making these services available, especially during the pandemic, CMS, that's the Centers for Medicaid and Medicare, or Medicare and Medicaid. That's the federal agency overseeing Medicaid and Medicare services, has allowed us to deliver MHR services via telehealth. These services include community psychiatric support and treatment, known as CPST, psychosocial rehabilitation, known as PSR, crisis intervention, known as CI. They also include our evidence-based programs. So that's ACT, FFT, Home Builders, and MST. In addition, LDH issued approval to utilize telehealth for conducting MHR assessments by LMHPs. One note, we do encourage the providers of the evidence-based programs we talked about to consult with their national EBP consultation organizations on guidance for adapting the EBP model for telehealth. As with the other services, MHR providers can find more information and guidance associated with MHR telehealth via Informational Bulletin 20-4. So we've talked about the various Medicaid behavioral health services of telehealth allowances. Now let's talk about the platforms that can be used. Telehealth allowances across behavioral health services. Providers offering services via telehealth must use a secure HIPAA-compliant platform if available. If not available, and only if not available, providers may use everyday common technologies, including audio-only delivery, for example, a telephone. Or they can use video conferencing, for example, Skype or FaceTime. Those programs have reasonable security and privacy measures, but must make sure that you have each recipient's consent before using those. Although a combined audio-video system is preferred, LDH is allowing providers to practice telemedicine, telehealth, through telephonic communications when appropriate. So those are the audio-only delivery, and it is allowed only in situations where an audio-video system is not available or not feasible. So can we use Facebook Live? Can we use TikTok or something like that? No. Facebook Live, Twitch, TikTok, and similar video conference communication applications are public facing. It means they're open to the public. It's easy to share that information and must not be used for telemedicine, telehealth services to preserve that confidentiality of the patient-provider relationship. Also, please be aware that texting and emails are not approved forms of telehealth. At a minimum, there must be an audio connection. Just a quick reminder that these flexibilities are currently only being allowed under the public health emergency, and we anticipate providers will need to return to the audio video delivery once the allowances expire. Updates for behavioral health providers who serve Medicaid recipients will be made via those informational bulletins that we talked about a little while ago. Okay, a discussion on telehealth would not be complete without talking about some common and very important guidelines. Keep in mind, confidentiality still applies. This is important. The provider delivering the services has an ethical responsibility to maintain confidentiality. In addition, before beginning a telehealth session, it is incumbent upon that provider to consider privacy and security risks, identify any that may be there, and address those. Number two, do not record the session without expressed consent from the recipient or their legally authorized representative. We recommend that this also be documented in the patient's record. You also want to verify the recipient's identity. How do you do this? You ask questions, what is your name? What is your date of birth? What is your Medicaid number or your address? Just something that's easy for your patient, your recipient, to be able to respond back with a correct answer. You also want to develop a backup plan, for example, phone number where the recipient can be reached. This is to restart the session or to reschedule it in the event of technical problems. The line cuts out, there's some sort of weather event and people lose power. One or the other's phone loses minutes and the phone is disconnected. So you do want to make sure that you've got a backup plan and talk with your patient about that before beginning the session. The recipient must be informed of all persons, so these are persons seen or unseen, who are present during the session and the role that they will serve in the session. For instance, let's say you bring in a case manager to help provide some various community supports for your recipient. Make sure to identify who that case manager is, their name, their purpose for being there, and ask if it's okay. You know, make sure that the recipient is okay with that other person being in the meeting with you, the meeting together. Recipients may refuse services delivered through telehealth. They have every right to do so. So you want to be respectful of that. It's important for the provider and the recipient to be in quiet, private spaces, free of distractions during the session. This is essential for a telehealth session to be successful. So you want to make arrangements not to be interrupted. Try to plan that with your patient as best you can as well. Providers need the consent of the recipient and the recipient's parent or legal guardian and their contact information prior to initiating a telehealth service with the recipient if the recipient is under 18 years of age. So document that consent thoroughly. There's a lot of information available about documenting consent, informed consent, documentation of telehealth appointments and the patient's record in general. You'll find a lot of that information in those informational bulletins, all three of those informational bulletins that we referred to earlier. You can also find a lot of information online, honestly, and through the American Psychiatric Association. Some other quick considerations to think about: practice and self-observe. Maybe tape yourself and review it before conducting a real session, just kind of see how it goes. Patient care. You always want to make sure that you're delivering services in a patient-centered way. So be respectful, practice active listening, be culturally sensitive, use eye contact, check in with them from time to time during the session. You know, just ask quick little questions. How are you doing? You doing okay? And wait for their response. If this is a group session, make sure to do introductions, engage others to get involved, set some ground rules ahead of beginning to set structure for the group. You want to make sure to do some general prep work ahead of the session, decide the main goals, read the chart, get organized, be mindful of how you're dressed when using video, so dress in a professional appearance. Quick tip, apparently stripes can cause dizziness in a video interaction, so you may want to stay away from stripes if you can. Also consider encouraging family members to attend if appropriate when there's significant cognitive impairment or maybe due to the young age of your patient, as it can enhance patient acceptance. So now I'm just going to address billing Medicaid telehealth very briefly. Just a couple of notes on this. Generally, you're going to, on your claim, you will input the procedure code for the service that you've delivered. For example, 90837 for therapy, or H0036 if it's community psychiatric support and services. And then you're just going to append modifier 95 to that claim, as well as include O2 under the place of service. A reimbursement for services are generally very similar to in-person visits in terms of the codes that you use. Just be mindful of any particular terms or conditions that you may have with the managed care entities. So now we're going to get into some of the fun stuff.
Hi, good morning, Candace Grace. So we're going to talk a little bit about telehealth utilization. So as Robyn mentioned, there were a number of flexibilities that were put in place to ensure member access to care. Following the issuance of those informational bulletins, we wanted to start looking at the data pretty early on to note what type of impact telehealth may have had. What we saw was that in November of 2019, compared to the last week in March of 2020, we saw approximately 300 members in November compared to approximately 20,000 members in March receiving services through telehealth. Corresponding increase in the number of providers, so 40 providers per week delivering services through telehealth in November of 2019 compared to approximately 900 in March. So the services that we saw with the most utilization in March were community psychiatric support and treatment, psychosocial rehab, therapy services provided by LMHPs, evaluation and management services provided by prescribers, evidence-based practice services, specialized behavioral health services provided in FQHCs and rural health clinics, and substance use intensive outpatient treatment. The next couple of slides are going to highlight the shift to telehealth, looking more closely at data by service level, and it includes also more recent data. So the first slide is around our assertive community treatment. So you can see the delivery of those telehealth services beginning in March following the issuance of those informational bulletins and increases in subsequent months. I want to just caution you here, just due to the amount of time that providers have to bill. I believe providers have about a year to bill, and the amount of time it takes for claims to come in, this data should not be considered complete. Our next slide is on community psychiatric support and treatment. So again, we're showing the utilization of those members receiving services through a telehealth means versus non-telehealth. So we can see here, there's still delivery of those in-person visits. The same for our psychosocial rehab. And also our evaluation and management services. So these are services that could be delivered through telehealth prior to the pandemic. So we can see that there were instances before March where those services were delivered through a telehealth means, but very sparingly. We can see some increases following the issuance of those informational bulletins in March and the stay-at-home order in response to the pandemic. For therapy, that's another area where those services could be provided prior to the pandemic through telehealth means. So we see very little utilization before, and then a more of a shift to telehealth following. For substance use, we haven't seen, and this is substance use intensive outpatient treatment, we haven't seen as much of an increase in the utilization of telehealth for that particular service, but we do note that that flexibility is in place and there was some delivery of telehealth services during each month following March. So the Centers for Evidence to Practice recently conducted a survey of behavioral health providers to understand the clinical impact of the sudden change in clinical practice following the stay-at-home order for providers. There were approximately 307 providers who responded to the survey, 85% of which who reported they continued to serve clients through telehealth after the stay-at-home order. Of those utilizing telehealth, 89% reported using a HIPAA-compliant telehealth platform. In terms of staffing level, what the survey indicated was 87% of providers maintained their pre-COVID clinician staffing levels, 5% decreased staffing levels, and 4% reported an increase. In terms of clients, 46% reported seeing fewer clients. What we found was the loss was mostly for those providers delivering child evidence-based practice services. 35% reported seeing about the same number of clients, and 19% reported seeing more clients. In terms of referrals, we see 33% reported no change in referrals, 20% reported an increase in referrals, and 47% reported a decrease in the number of referrals, with 52% of those indicating a referral loss of 50 to 100%. So really big changes to the referral system following the pandemic. So in terms of the barriers to telehealth that were reported by providers, the first was client access to internet data devices, 78%, that was a barrier. Client knowledge of technology, 66%. And the ability to reach hard to reach populations, 36%. In terms of facilitators or helpers to telehealth, increased access to clients, 57% reported that. Ability to reach hard to reach populations, 45%. Ability to reach treatment outcomes with telehealth, 21%. So we can see that this shows that there can be an increase in access to care for hard to reach populations like those in rural areas, but additional supports are needed for those that may not have access to a smartphone or who are not comfortable using technology. So all in all, I think this data shows that behavioral health providers leverage telehealth flexibilities very quickly to continue to maintain clients' access to care. So with that, I'm going to turn it over to our moderator for question and answers.
If you have any questions, please use the Q&A function. Okay, we have one question. How long does the state anticipate the telehealth allowances?
So the short answer to that is we really don't know. It's going to depend on how long the public health emergency is in effect. We anticipated at least through October of 2020. We know that it will continue past that date at this point. So we've got a lot of things in Louisiana that play into this. We've had the weather emergencies, but we've also had COVID. And so we are really taking this on a day-by-day, month-by-month basis, and we'll continue to allow those flexibilities as long as CMS allows us to do so, and there appears to be a benefit to doing it.
Okay, Robyn, we have another question that you may be able to answer. From Ms. Osborne, can we ask clients not to wear pajamas and to avoid doing other things during the telehealth session, like combing their hair or cleaning up? If so, any suggestions on how to communicate this to them?
Well, you want to be sensitive to who your patient is. You know, a lot of this is going to depend on their, you know, their mental health illness. Is it good enough that you've had them show up to the telehealth appointment, even if they're in their pajamas or they're fidgeting with combing their hair. You want to really be mindful about providing patient-centered care. You know, that means to meet the patient kind of where they are. They're there for the appointment. They are there because they want that engagement with you. Now, does that mean that you can't redirect them if there are things that you can pull into your, whether it's a therapy session or a PSR session or a CPST session? You know, is it an opportunity to provide some education or some skill building? Then, you know, you can use that to do so. But I would caution people to be respectful of their clients during their sessions and to meet the patient where they are and use their judgment, use clinical judgment if you need to check with a clinician about, you know, whether or not bringing skill building or education into your telehealth appointment might be useful based on what you're seeing.
Thank you. So we have another question, and Candace, I think this question is for you. Can you go back to the comparison slides of November 2019 and March 2020?
Sure. Okay, so I think this may be the slide you're referring to. So again, this slide is showing what utilization looked like in November of 2019 prior to the pandemic, and then in March following the pandemic, following the issuance of those informational bulletins, allowing telehealth flexibilities. And so what we saw was there were approximately 300 members per week in November receiving a service through telehealth compared to 20,000 per week in March. We also saw a corresponding increase in the number of providers delivering those services. So 40 providers delivering telehealth in November of 2019 compared to 900 in March of 2020. Please let us know if there are any further questions you have on this slide.
Thank you, Candace.
Thank you.
I have another question. What are the resources providers can utilize to support telehealth practices?
Yeah, so that's an excellent question. We will be making a resource document available after the conference that will have a number of different links on it, not only to the informational bulletins, which themselves kind of have a plethora of various information that's helpful to telehealth delivery of behavioral health services, but also some resources from national organizations, SAMHSA, the American Psychiatric Association, and other such entities that not only provide some guidelines or some helpful hints, some of them have toolkits that can be used for both med management type appointments, psychotherapy type appointments, non-clinical or MHR, mental health rehabilitation type appointments. So we'll make those available. I do want to mention just real briefly that we noticed in progressing the slides that we had made some revisions to a couple of the data points in those bar graphs that doesn't appear to have been updated to the slide presentation that you're seeing today. So when we make this slide presentation available after the conference, we'll make sure that you get that revised and updated slide presentation with the correct data graphs, bar graphs.
Thank you, Robyn. Do we have any more questions? Please put your use the Q&A function to submit your questions. Okay, I don't see any additional questions coming in. So I would like to thank Ms. Wait, I see a question. If there are multiple telehealth platforms available. What are your thoughts about clinicians who only want to utilize telephones or telehealth? Would you like me to ask it?
Yeah,
ask the
ask it
question
one more
again?
time. I just want to make sure that I have the gist of the.
If there are multiple telehealth platforms available, what are your thoughts about clinicians who only want to utilize telephones for telehealth?
Right. So, again, I think I don't want to pass judgment on a clinician that is using a telephone versus a video, because I don't know the circumstances. We don't know the circumstances about that patient that they're meeting with, what the patient's circumstances are. So, in some instances, phone may be the only way that the recipient can actually have an appointment with you. So the other thing that I would say, though, is if you have concerns that providers might be using video and audio, that they're using audio only where video and audio may be more beneficial to that client's needs. Speak with your medical director, your clinical director at your group practices. Well, speak with the person first, and then speak with that clinical director or medical director at your group practice or your organization's agency head, and use it as an opportunity to have a conversation there.
Does Medicaid have a preferred HIPAA compliant platform for telehealth?
No, we really don't. There are a number of HIPAA compliant platforms out there. Some of them are free, some of them cost money. They all have, benefits, pros and cons. So what I would say is to do some research, see what fits best for your practice or your agency, and seems to best fit the needs of your clients when choosing a platform.
Do we have any other questions around telehealth utilization? And remember to put your question, use the Q&A function to submit your questions. Last call for questions. Okay, well, again, I would like to thank Candace Grace and Robyn McDermott for their time, and I would like to thank you all for listening in, and you all have a wonderful day.